What's up, everybody? My name is Christian Davis. I'm a student at Grand Canyon University. This is the Topic 6 assignment video. We're talking about biases and discrimination amongst special populations in behavioral health. So, to begin with, I just want to say that there are two different cases or instances that I want to cover that highlight discrimination, particularly of those who have disabilities, which are among the most overlooked populations and demographics in terms of behavioral health care accommodations and things like that. So the very first thing I want to talk about is the United States versus Uber Technologies Incorporated. It's relatively recent. This case was opened in September 2025, so just a couple months ago. The United States government had actually sued Uber, alleging discrimination against disabled passengers. So apparently, there were consistent reports of passengers being refused if they have wheelchairs, if they have service dogs. There was also different charges and fees that Uber was applying to some of these customers if they had service dogs, if they had cleanup from these service dogs, so on and so forth, as well as different cancellations for rides and things like that. Some passengers were actually subjected to different insults, and they refused accommodations that they were needed in order to transport from point A to point B. So this isn't the first time that Uber has actually been under fire for something like this. The first time was 2021. They'd previously been taken to court actually for violating Title III of the ADA, which is the Americans with Disability Act that protects people who have disabilities and is there to ensure that they have the proper accommodations that they need when they go through and enter public spaces. So right now, the Department of Justice is actually seeking several penalties and amendments to the Uber policies as they relate to disabled patients. Furthermore, we have the Flixbus and Greyhound discrimination investigation, which was opened back in August this year. So apparently there were several reports just of poor maintenance for lifts on some of these buses. There was a refusal of assistance for disabled passengers who actually use these lifts. There's also a refusal of service dogs who accompanied these passengers. And in between stops, some of these passengers who had disabilities were left stranded. And then also at some of these rest stops, some of these people who experience disabilities were not able to get off the bus and experience some of the same, freedoms and privileges and things like that that some of us able-bodied people would experience as well. Just having to sit on the bus, not able to go to the restroom, grab food, so on and so forth, that kind of thing. So I can't necessarily say that there is a long-term outcome for either of these as they're both really, really current, but just based on previous cases and similar instances of discrimination of these people, there are certain conclusions that we might be able to draw. Now, for the case that was filed against Uber, they're facing civil penalties, and also they're going to be forced to revise some of their policies, especially those that relate to people who experience disabilities, to make sure that they're complying with laws set forth by the ADA. In the case of Greyhound and Flixbus, long-term outcomes can be assumed, again, based on previous investigations. So right now they're facing potential civil penalties. They'll be paid to the United States. They'll have to compensate some of those people who were victims of discrimination, as well as for training. There's going to be more enhanced training for employees so that they're able to operate and have that familiarity with different accessibility features on their buses. There's also going to be greater oversight by ADA managers, technical training, and there's going to be regular reports of the ADA, just with the oversight. So in the behavioral health setting, there are three different ways that I've highlighted that people with disabilities can experience discrimination. The first one is ableism, which is essentially discrimination against these people based on their physical presentation or their mental, cognitive, whatever type of disability it is that they experience, that they live with. So this might be refusal of service, refusal of accommodations, preferring other clients over those who might experience disabilities. So in order to address this as professionals in this field, we have to be more culturally competent, and perhaps we need more extensive training programs to become more familiar with some of the struggles that people in this population experience. Communication is another way that they might face discrimination. So those who might have cognitive or mental disabilities, if they're going to seek service, the person who is giving them that service might assume that perhaps they don't understand certain terms. They might try and speak to them as though they're a child. Total disrespect and total disregard of them as a human being who has choices and things like that. So that's another way they experience discrimination. Another way is accessibility. For resources to be accessible, the person that has the disability should be able to experience and use that resource with a similar amount of time, similar effort of somebody who's non-disabled. So there's different ways. Obviously, there's lack of flexibility a lot of times in the policies and procedures for disabled people, which essentially is a lack of accommodations. And a lot of times they're overlooked compared to other demographics in terms of, accessibility and being able to reach and connect to these people. So there are different ways that we as professionals, again, can counteract some of the discrimination that a lot of these people experience. A lot of that comes through with our training, our understanding, and becoming more culturally competent, because this is a significant portion that needs to be served and has a specific understanding of the world. They have specific experiences and everything like that as well. Sometimes there's going to need to be referrals if we're not culturally competent and understanding enough of how to help some of these people. Some of these people who experience some of these disabilities, regardless of where they are, what kind of disability it is, they might actually need specialized care. So it's up to us to determine that and figure that out with their help and their understanding. And then from that, move on and refer them to somebody who can actually provide them with the help and the service that they need. Another way is the way that we speak to clients who experience disabilities, not speaking below them, not speaking to them like they're children, speaking to the client, not to the person that brought them to their appointment and everything like that, and tailoring our communication style in a way that's beneficial and preferential to our clients. Also got to be aware of our body language and communicate openness, because the more that we do that, that's also going to promote engagement. So in terms of future training for professionals in this field, we're looking at extensive trainings, perhaps different specialized trainings, because not all disabilities are the same. Not everybody has the same experience. There are certain levels of capacity and ableness that some of these people who experience disabilities have. It's not just the same across the board. So specialized training, technological training as well in terms of accessibility. We live in an ever-changing world with rapid technology advances. So there's going to be different things that we'll probably have to learn in order to reach that population online and through mobile platforms. Another thing that professionals will probably need to acquire is a greater familiarity with the ADA, which is the Americans with Disabilities Act, which provides those accommodations, legal accommodations for people who experience disabilities in public spaces. So greater familiar with Title III in particular. Also, we can participate in different trainings that are offered by the ADA. So they offer symposiums, webcasts, podcasts, in-person trainings, web courses, workshops, you name it. The resources are out there. And in general, we just need to have a greater understanding of the unique perspectives and experiences of people within this population so we can actually reach them. And I just listed a few different approaches that have been proven to be really effective with people of this population. So we're looking at person-centered thinking, trauma-informed care, things that are culturally relevant to this population, looking at strengths-based approaches, positive psychology, people first language, which essentially is we are not labeling these people as disabled people, but these are people who also have, whatever disability, whatever it is that they're working through, right? Seeing them as humans before seeing them as, defected or deformed or anything like that. Dignity of risk training. So in conclusion, again, I've just highlighted a few different instances where people of this population, people with disabilities, are experiencing discrimination. I've highlighted some of the consequences for that discrimination. Obviously, there's legal, civil, compensatory things to follow. And I've also highlighted some different ways that we as professionals can help this population, offer them the very best care and an equal care compared to their able-bodied counterparts. Thank you.